Sorry I haven't made a video. It's been 5 weeks since I had the operation, and I've been in hospital for 4 weeks, and I've been a bit poorly and a bit ill. So I'll tell you about that in a minute. Yeah, I've had the Ravitch procedure, and I'll tell you about my experience about this procedure. Going into getting wheeled into theatre was quite a daunting experience. I didn't enjoy it at all. It seemed like a long wait. They put me to sleep, knew nothing about it. When I came round, it was a 5 hour operation. And when I came round from theatre, I didn't have any pain, but the feeling in my ribs and my sternum when I was breathing, it was just cracking, it was clicking and grating and making all kinds of weird sensations. It was horrible. But obviously I had the button for the morphine, I just kept pressing that. What it's done is, it's made a large incision that comes all the way under the nipples. It ends about there, so that it could get right into the top part of my ribs. Is then they dissect your muscles away from your chest wall, and they clamp everything out, and it's your skin and your muscles are out here. So for about 4.5 hours, my muscles didn't have a blood supply to them. So, and what he's done is he's broke my sternum in the middle. He snapped the tip off because it was totally and utterly, it was too distorted, it was irreparable. He's dissected all parts of the cartilage all the way up to free the sternum off from the ribs. And then when he came to reconnect everything, he couldn't do it because my bones were that distorted. So he's fractured all my ribs all the way down. And the only two ribs that he didn't fracture were these two here. These two ribs, he had to make heavy fractures to straighten them. And then he's put it all back together with a longer and thinner bar that goes all the way around, and it connects under my armpits here. I can actually feel it screwed into my rib cage at the side here. It's still quite painful. Whereas usually with a Ravitch they have a much shorter bar that sits on the outside of the rib cage. This one of mine's on the inside of the rib cage, and it's taking a lot of getting used to, I'll tell you, because it feels like I'm clamped, and when I'm laid down on the night it's quite uncomfortable. It takes a lot of getting used to. Unfortunately, when they come to reconnect the chest muscles back, they've just gone to jelly on my chest muscles, and all the skin were overstretched, and I had so much swelling around the chest area. It was unbelievable, and it just looked like I had a pair of tits, basically. But the swelling has gone down a lot, and that was it. That was the operation. I had the PCAS where you press for the morphine, which I was pressing far too much. Ended up making myself sick. I was throwing up, and that was just horrendous. Being sick, feeling wrenching, and feeling all the feeling in my sternum was just unbelievable. So they took me off the PCAS and put me on oral morphine, and I started hallucinating on that. So I had to come off that, and they put me on different types of medication. And it was really, really hard to try and find the balance, and there were a lot of times during that 5 to 6 day period that I felt the full force of the pain. It was horrendous, absolutely excruciating, severe pain. I never felt anything like it. It just takes over your whole body. My body was just shaking. I've had a swollen abdomen since I had the operation, but the doctor says it's probably due to the antibiotics that I'm on. On the 6th day, on the Sunday I was due to get released, I became infected, caused from a bacteria called coliform, and it ended up with a wound infection. And there were gunk, it was disgusting, it were all coming out on my chest, it was coming out of these drain holes. So they took me back down to theatre on the Monday, and they reoperated on me. They cut me open again, cut any dead tissue away. They did an excavation of the site and sucked all the pus out, everything, cleaned it and sterilised it, and then they squirted it with antibiotic, and then they stapled me back together this time. The first time they glued it, and it was quite a neat thin line, but then after having the second operation I had to have staples just in case the infection came back, so that it could go through there. So they put another two, for the first operation they put 2 rocket drains in which go underneath the ribs and into the pleural space where the lungs are. You've got two small drains that cover the outside of the chest. They came out one by one after about 5 days. And then when they did the second operation, they put two rocket drains in through these patches here, which went into the lungs again. No, sorry, they sat on the outside of the chest, but they were quite big drains, and they were quite painful. Anyone that's had this operation will tell you that when they pull these drains out, it's horrible. It feels literally like they're pulling a snake out of your lungs. It's a weird sensation, not very nice. It can be quite painful. These second two were the most painful by far. But these holes here, they've not sewn them up, they've left them open, so it looks like I've got bullet holes, so that if I do get infected, it can come out of this hole. So basically, touch wood, I've been on antibiotics now for 4 weeks. I'm on oral antibiotics now, and I've got to take them for another 5 weeks. So touch wood, really, I should be alright, as long as this infection doesn't come back. If it does, I'll be back in hospital again. As far as the operation goes, medically, it's been a success. It's not only lifted my sternum up, but it's flattened my ribs, and it's taken my sternum away from my heart. And I've had a second CT scan while I've been in hospital. And my heart's a much more healthier shape. It's much more rounded, whereas before it was quite oblong. It was quite squashed. It was just squashing everything. And my surgeon said it was much worse on the inside than it were on the outside. But unfortunately, cosmetically, it hasn't been too kind to me, because it's left me with really jellified pec muscles, and it's non-existent at the minute. But that's something to worry about in months to come. The main important thing really now is to get back to full fitness and get back to work. That's my main aim, and then I can worry about cosmetics after that. But hopefully, touch wood again, I don't get this infection back. But apart from that, it's not too bad. I went into the operation weighing 14 stone, which is about 89 kilograms, and I came out of the hospital weighing about 12.9 stone. So I'd lost over a stone. I put a little bit back on again, just through the infection. But I still, I've got quite a swollen belly. These holes here are taking quite a long time to heal, because obviously they didn't stitch them back up. But apart from that, I'm okay. I'm doing all right at the minute. It's taking a bit. Again, this bar doesn't feel nice at all. But my surgeon assures me that in about a few weeks' time, it'll become a part of my body, and I won't feel it. And I hope he's right. Otherwise, this bar will have to be coming out earlier. He's keeping it in for 2 years, just to make doubly sure that this indentation doesn't come back again. So that's my experiences on this operation. I wouldn't strongly advise having this done for cosmetic reasons, to put yourself through all this just because you don't like the look of your chest. Is just, I think, too much. I would never have it done for cosmetic reasons. There is always the nose procedure, but I couldn't have had the nose, not with my deformed bones and the cartilage and everything. My sternum, I would never have been able to do it. It wouldn't have been successful on me. So I'm glad I've had the Ravitch, but unfortunately my recovery time is going to be a lot longer because of the amount of fractures that is made to my rib cage. But yeah, this is 5 weeks, and I'll put another one up at 3 months, and then we'll see where we go from there. Feel free to make any comments. If you want to ask any questions, I'm more than willing to ask. So thanks for watching, and bye bye.